Welcome back to our channel! Today we're diving into the Copernicus trial to explore the impact of Carvedilol on patients with severe heart failure. Let's find out how this beta blocker fares in improving survival and reducing hospitalizations. The bottom line? Carvedilol reduces the risk of death or heart failure hospitalization by 31% compared to placebo in patients with class 3I4 heart failure and an ejection fraction, or EF, of less than 25%. The role of beta blockers in chronic compensated heart failure with reduced ejection fraction, or HFrEF, was established by trials like CIBUS-2 and MERIT-HF in 1999. However, their role in patients with severely reduced EF remained unclear. The 2002 Copernicus trial aimed to address this. Copernicus was a double-blind, randomized, placebo-controlled trial involving 2,289 patients with an EF of less than 25%. Patients were randomly assigned to either Carvedilol or placebo, in addition to standard heart failure therapy. The trial had a mean follow-up of 10.4 months. The 2013 American Heart Association and American College of Cardiology Foundation, or AHA-ACCF, heart failure guidelines recommend the use of bisoprolol, carvedilol, or metoprolol sustained release for all patients with symptomatic HFrEF, unless contraindicated. This is a Class Y, Level A recommendation. Participants included those with dyspnea or fatigue at rest, or with minimal exertion for more than 2 months, effectively New York Heart Association, or NYHA, Class 3I4 symptoms, and an LVEF of less than 25%. Exclusions included volume overload, acute illness requiring hospitalization, and recent intravenous inotropic therapy. Patients were started on a low dose of Carvedilol, 3.125 milligrams twice daily, which was increased at 2-week intervals to a target dose of 25 milligrams twice daily, as tolerated. Regular follow-ups were conducted every 2 months. Let's look at the results. Carvedilol significantly reduced annual mortality from 19.7% in the placebo group to 12.8%. with a relative risk reduction of 35% and a number needed to treat, or NNT, of 15. It also reduced the combined endpoint of death or heart failure hospitalization by 31% and other key outcomes, including cardiovascular hospitalizations and any cause hospitalizations. Adverse events were also monitored. Serious adverse events were lower in the Carvedilol group, 39% versus 46%. Heart failure exacerbations and cardiogenic shock were significantly less frequent in the Carvedilol group, though there was no significant difference in rates of hypotension or bradycardia. Despite its positive outcomes, the Copernicus trial had limitations. It didn't provide long-term data beyond 10.4 months, and its findings are specific to patients with severe heart failure and reduced ejection fraction. In summary, the Copernicus trial highlighted the significant benefits of Carvedilol in severe heart failure, reducing both mortality and hospitalization rates. Don't forget to like, subscribe, and hit the bell for more updates on the latest in medical research. Thanks for watching.